Roni, you've been here 4 days with us.
Yes.
This is the 5th day we're finishing. You just arrived. You're a qualified massage therapist.
Yes.
And registered in the state of Florida.
Yes.
And you're also qualified with other stuff, right?
Different modalities of body work.
And the spine, you've studied up on the spine.
Myoskeletal, yes.
And you actually work at a chiropractor's office.
Yes.
So now that you've worked with me as I'm treating John here, who's your client, what do you think of my approach? It's different, isn't it?
It's very different. It's very different. It's exactly what I think we need, what more people need.
Yep.
I've seen huge changes in him, great changes. I know he has seen those changes within himself.
Yep. Yep, he has improved considerably, hasn't he?
Yeah.
So you recommend other people have a go at this treatment?
Definitely.
Yep.
Yes.
And do you support my desire to get a chiropractic college to take this treatment in as a program they can teach to other practitioners?
Yes.
Excellent. Good on
Not
you.
just chiropractor, even if you can get into massage schools and do the same thing.
Right. Yeah, well that's what I'm going to try and do. Thanks, Roni, for your input. It's been such a pleasure working along with you, and you did a couple of massages on John while I was there, and I can see you're really good at your craft. So
thank you. Thank you for the opportunity. Thank you for letting me be here and be involved in all of this.
Excellent, excellent. So now, John, what is your take on that? Did you like the way Roni massaged you?
The very first time we had a session, I knew that I found my masseuse.
She's good, isn't she?
Very good.
Yeah.
Magic hands. And on 2 occasions that I recall, we both recall, I came off the table quite euphoric.
It's been a pleasure, John. Thank you for bringing me all the way down here.
During this year, not able to squawk at me about standing straight. I got my wife to do that now.
Yep.
So you're
And Roni will do it. She'll pick on you.
for a while. And she'll also chase after me.
The art of keeping hold of clients is getting on their back and pushing them, but not hurting them. What was your very first symptom, and when did that develop prior to the diagnosis?
I would say 2 or 3 years before the diagnosis, I developed a tremor in my left-hand ring finger.
Left-hand ring finger?
My ring finger. It took quite a while for it to transfer.
Yeah?
Eventually it came into the right side as well.
Okay.
Then 2 years later, that's all the trouble, speaking. It's the worst thing that I'm uncomfortable with.
And what do you think causes that speech problem?
It's triggered by anxiety. It's triggered by what I have to answer the phone and deal with.
Okay, mate, so this is day 4, second last day. Are you going to be happy you got rid of me?
In some respects, yes. But in retrospect, I needed to be chewed on every once in a while to get the response that you were looking for.
Yeah, I don't hold back. I tell people how it is because you're paying me to do a good job, and sometimes that's how I do a good job. But you've been excellent. You had a nice smile on your face before I started treating you, and to be suffering the tremors and everything that you were suffering and still have a smile, that says a lot for your strength of character, mate. Now, the C1 vertebra is underneath the skull, right there, the first vertebra right near the skull. Now if you look at my thumb, you don't even have to do it, you can see them. This one's deep and that one's not. See that?
I got you.
So the C1 is turned like that. So bring your head back, mate. See it?
Yeah.
I mean, considerable, isn't it?
Yes.
You put your thumbs in there because I want you to know exactly where the position is. Don't push hard, just let them sink into the bone.
Okay. Yeah, I see.
Down lower. That's it. There you go.
Uh-huh.
See the difference?
Yes.
So if you see him shaking, especially when he wakes up in the morning, ask him to turn around and do that. The chiropractors don't know about all this information about Parkinson's. This is a book written by Dr. James Parkinson 200 years ago, and in this book he writes the cause of Parkinson's is a diseased state of the medulla spinalis in that part which is contained in the canal formed by the superior cervical vertebra and extending as the disease proceeds to the medulla oblongata. So the part of the medulla that comes from the brain that's inside the C1, C2 vertebra, when it's swollen, when it's traumatized, that's what causes these symptoms. Now, it's been written for 200 years, the information that I use to treat my clients, and yet nobody's acknowledging it. You can read the quotes from this book on my website.